Krystina. You might remember me from last season. Now I'm back and I want some big, round, high-up basketball boobs. My boobs now are like a flying squirrel's nutsack, super saggy, flying all over, heading in total different directions. Last year when I was here, I saw Dr. Dubrow for a breast augmentation.
So you need the implant pocket tightened and a breast lift.
Yeah.
Are you done with your weight loss?
No. I've probably got another 30 pounds to go.
Okay, lose your weight. You definitely could have this surgery.
Fantastic. After I saw the doctors, I was really disappointed, but I knew in the long run it was the best thing to do. And now I'm back for my new rack. I want my boobs to be high up, big round basketball titties, both in the same direction. Hi.
Hi, welcome to LA Slim Wrap. I'm Ashley. Very nice to meet you.
Since I saw the doctors last, I've carried on training, dieting. I've lost 35 pounds. I'm still super busy running the gym, been a personal trainer, and me and Andy have got married. He's a very lucky man now.
I'm gonna wrap you up like a mommy today.
Yay!
We're pulling the waste toxins, impurities out of the fat cells.
I've had a lot of surgeries over the years because I love the cartoon look. It wasn't till I had a caricature on that I knew that's the look I needed to have. I feel like an 80s fitness video. I've had filler, Botox, rhinoplasties, 4 breast implants, bum filler, designer vagina, stomach bypass, heart-shaped nipples. I think all those surgeries I've chipped away at becoming that caricature. So over the years, I've had 4 breast surgeries. I never have been 100% happy or confident with my boobs. Now I've lost the weight, I'm hoping to get these boobs done. And then from there, I can do all the little nips and tucks to get my body exactly like that caricature. Basketballs, here I come.
Dream on. Never mind that fear flying, you belong.
How many times have we seen a patient, and we've examined them, and they said, well, I'm about to lose a whole bunch of weight. And we said, well, we shouldn't do the surgery till you lose the weight. And do they ever come back?
I've had maybe about 5% of those patients come
Right.
back.
We actually had a patient we saw named Krystina who had a very significant breast implant complication. Guess
She's
who
here.
lost the weight? So here's Krystina.
This is now? Oh, she's thin.
Yeah, she looks great, right?
Yeah.
Look at all this laxity. Even worse now with all the weight loss.
Can you please send in Krystina?
Hi.
I should say nice to see you
See you
again.
again.
She's back.
I'm back. I'm nervous to go into my consult because this last bit of weight I'd lost, my breasts, they look a lot worse. So whether it's medically made them worse, I hope not.
Last time we saw you, you had some very significant breast issues,
Very.
but we didn't want to do anything because you had planned to lose a significant amount of weight.
Yes.
And you have.
Yeah, and I've done 35 pounds since last year.
Congratulations. Last time you presented with an asymmetric sort of complication. On one side, you had capsular contracture. On the other side, you just had a very droopy breast.
Yes.
But you also had very large breast implants.
Yes.
Now that you've lost the weight, you've kind of made the situation
Worse.
more challenging, worse.
Man, you got a difficult case.
Yeah. Krystina's case gives me a lot of pause for concern because when a patient like her has lost a lot of weight, you lose a lot of breast tissue and the skin stretches. So when that happens and you remove a lot of the skin, you also now are dependent upon the underlying blood supply in that thin breast tissue. You have 700 cc's now. I mean, are you willing to be much smaller?
As you'll see when you look at them, I've got very little breast tissue. It's just implant.
Yeah.
So I wouldn't want to go like half the size or anything like that.
So you've gone very large. And you've had a complication 4 times. And so the 5th time, instead of doing breast lift and putting a smaller implant in, which would help to minimize the complications, you want to go very large and you expect not to have a complication this time.
I know what you're saying to me, but I also know how unhappy I'd feel with these, what I'd feel like was not my body shape.
So you have to be open. Otherwise, forget it. Because right now, they're displaced and they're hanging, they're over here and all that, and they don't look good. But if you maybe bring them back to the center, if it's possible, that means you're gonna have to have a smaller implant.
So I didn't come all this way, do all this hard work to get tiny little titties.
We have to look at your tissue thickness very carefully. Why don't we go in the exam room and figure this out, okay? This is a very difficult case, and in many ways, scary. Be afraid, be very afraid. If I recall correctly, don't you have a heart shape around your areola?
I do, yeah.
Now, are those tattoos or?
Tattoos, yeah.
Let me see that. So, do you want to preserve that heart shape? Or you
Not
don't care?
bothered. Don't care.
I remember you had an animation phenomenon, right? Could you show me that? Put your hands on your hips and, right. And you can wink them or something, can't you? Look at that. So, is that something you want to address as well? Okay.
Yeah.
What I see here is you have some firmness here, which is a type of capsular contracture, but not as severe as this type of capsular contracture because this type has pushed the implant up here and you've lost so much weight, it's droopy. Here's the question. What's the blood supply like? Because when we do a breast lift and skin removal, we're removing blood supply with it. And the more blood supply you remove, the greater the chance that things will not heal and the nipple and surrounding tissue can die. I think the risk of losing the nipple is elevated. I don't think it's 50%, but it's way more than 5%. How do you remove all that skin, keep enough blood supply intact to keep the nipple and areola alive, and not have a devastating post-operative complication? I'm about to say something that I think is going to make you very happy. The more I downsize your breast implants, the looser the skin. The looser the skin, the more skin I have to remove to do a lift. So to a certain degree, it's kind of safer to use a larger implant. And the scar tissue manipulation I'm gonna do on you, I'm gonna do it to a lesser degree. That should reduce the chance of a recurrent capsule formation.
Can't say I'm not happy.
Right? Do I think you could have a good result, although it's a high-risk situation? Yeah, I do think it's
That's
a
all I need
risk
to know.
potentially worth taking. I do. I feel comfortable. And
So the answer is?
Yes.
you absolutely 100%. Let's do this thing.
In my head, I was jumping up and down. I was trying to keep calm, but inside, I was just so happy that my worst fear of tiny, tiny titties hasn't come true.
We'll see you very soon, okay?
Fantastic.
All right.
Thank you.
See you guys later.
This is what we're gonna do today. We're gonna go in and make an incision and take the implants out and rearrange the scar
loving
tissue
dog
to allow the
to
new
being like,
implants
no way again.
to be put in a
Going
better
to a park
location.
sometimes,
Then
it's like, oh God, are they
we're
gonna
gonna do a
installed?
lift.
My name is
hopefully
Crystal. I was
keeping
bitten by
the
a dog
nipple
when I was young, and I
alive
was
the
left
whole
with
time.
a heart-shaped,
So I feel like I've been on a really long
hairy
journey.
skin
I've been
patch.
going for nearly a
seriously,
decade now with
catching
not
my
liking
face
my
may look
boobs.
like heart, but
Here I
I've
am
got
today
no love
to get
for
my
it.
body
The
exactly
doctor
like
said
that
that he
chart.
would
So I can't wait.
grab.
Normally,
Then the
I like
hair
to
came.
downsize the
The
implant to
squiggly
reduce
hair.
the chance that she will form scar tissue
Skin
again.
graft
But Krystina's
came from
unique
my
because I
groin,
need a
very
large
close to my
implant to
pubic
fill up
area.
the pocket
It's
because if I
genital hair.
downsized it too
Everything.
much,
You
it would
can
make the
diminish
skin
it,
even
but
droopier,
you can't take it away.
requiring me to lift the
I
nipple
started
up even
fucking it,
higher,
but it's
which would
only
even be a
temporary,
greater
and
risk
it's
of losing
darker.
blood supply to the
I
nipple
put
and
lemons on
potential
my
nipple
face
loss.
to see if that would brighten it. So now I'm hoping the doctor can improve it
For
dramatically.
Krystina's
It's
surgery,
time.
I will
It's
make
been
an incision under
over
each
20
breast
years.
and remove her
I can't
current
even
breast
remember not
implants.
having it.
On the right breast, I will remove any
So we have
scar
Krystal.
tissue I
She had a
find
dog bite
and
to her
release
face.
the muscle, causing
She
her
had
breast to
a skin
animate
graft
or
to her
wink.
face.
I will
That
then
is
put in a larger
looks
set of
like the
implants
shape
in
of a
each
heart.
breast.
Not a lot of
Then
options for
I will
this.
remove the
No,
massive
there's-
amounts
there's-
of black skin
We
that
gotta
she
think
no
of this.
longer needs
Can you
and
please
finish
send in
by
Krystal?
giving her a much-needed breast lift. Krystal.
How are you?
Hi.
Nice to meet you.
Hi, how are you?
Dr. Dubrow.
Big smile.
Lynette.
Andy, how are you? Good to see you, my man.
Nice to meet
So I
you.
started on your
So
right.
we'd love to hear your
made
story
an
and
incision,
why you're here to
and
see
I was
us.
met with a
When I
surprise.
was
And
9
that
years
your
old,
implant
my grandfather was holding
not
a dog.
just
I was
ruptured,
actually pretty terrified of the pit bull.
exploded.
All I remember is
These are very strong. Full attack mode.
yeah.
Okay.
So he bit out
Dr.
the chunk
Nassif
of
and I
tissue.
have put these to the
clean.
test.
Then we went to the emergency room, and there the doctors suggested that we wait
that was a good
until
one.
we see a
What else can we
plastic
do?
surgeon.
Crystal was very lucky that the emergency room physician
Let's run it
didn't
over.
try just to
Okay.
stitch up that
Okay,
big
you ready?
gash and opening in her cheek. Because the ER doctor
are
does
indestructible.
not have the
I've
same
never
skill set
seen
as a plastic surgeon. If they
An
did, it would have
implant
been like
so
this.
ruptured, so exploded.
How long was it
so
open before you
destroyed
had
as
the
the one in
surgery
your
done?
right breast?
I was open
That
for a while,
now
like how the
explains why
outside
it
of
was so
Freddy
far
Krueger's
up
face
there.
looks like
Yeah.
with the burn. That's what the
Let's have a
inside
look,
looks like.
okay?
So we
So
went
today is
to
really all
the
about
doctor. He
like this,
suggested the
with
skin
nipple
graft.
survival.
Take it
Fingers
from the
crossed,
groin.
So
both
what
my
happened with
nipples
it?
should be where
They
they
did the
should be and
surgery,
alive.
and then the hair started growing.
So you're getting pubic hair on your face.
Yeah, literal
See that?
pubic hair. I don't believe
Not blue,
that the doctor
not
mentioned
dark.
I would grow pubic hair out of my back.
We were very happy.
I don't remember that.
It's interesting why they chose
These
it
are
from the
definitely my new
groin,
babies.
because there's
I'm
so
gonna
many
look after them
places.
the best
They
I
could have done
can.
the back,
What
the
they look
abdomen. You obviously
have
wouldn't do
happened.
the armpit.
How
Yeah, let me
has
ask
this
you
year
about
since,
that. Can you
affected
recall
your
any
life?
trauma?
I at first
Anything
thought
that could have
it
led to
didn't
that?
affect me since having my daughter. I really started to get conscious of it.
She may have ruptured your implant.
She's 6
I had to go
months.
to hospital.
I'm
'cause
worried
not myself
about the
out,
kids that
and a
she'll go
massive
to
bruise on my
school.
bum.
So you're worried about the future.
And then I ended up
My
where I
daughter,
was
her
there
name
quite
is
a while
Sana.
because they thought I
She's
had
6
broken
months
ribs.
now.
That's the
After
only thing I
having
can
my
think
daughter,
that
I
would
am
have done
very
that much
nervous
damage.
about how other
So far,
kids
so
would treat
good.
her.
All right, let's keep a
because of
close
how
eye on it, though. I want to see
I
you a
don't
lot
want
more
her
office.
to
I want to make
be
sure
teased.
the wounds continue
We're
to
a
heal.
little
Thank you very
amazed.
It's
that
my pleasure
you
to
have
have that
that
large
great
chunk
see you
taken out of
and,
an area where there are so many facial nerve branches. This is
Probably be the first
expertly
time
done
that she's going to feel
reconstructive work.
What do
comfortable
you want us to do?
with
If
her
we
own
can
skin,
make it as
what she's
small
got.
and as
And
minimal as
I think it's
possible,
going to be a pretty
that
special
would be
moment.
perfect.
Crystal's case is actually deceptively very complicated. That skin graft is very close to critical
Fantastic.
anatomic
So,
structures
here I
like the
am,
nose,
not
the
wearing a
cheeks,
bra,
and the eye.
so I can't
That
wait
if
to
altered
see this
even a
portrait
little
of
bit,
me.
can
So I'm
change
hoping
the
now we can get
entire shape of the
started.
face
So I suppose I
and
should
look
take this
very
off.
deformed.
So
You
let's go
ready?
into the examination room. We'll evaluate you, and
Wow,
then we'll think
whoa.
of some great options that we can help you with, okay?
So I don't need that no more. The face the right way. Yeah. Go forward. They're not there. Go back. Yeah. Absolutely perfect. I love them.
Do you think you used a different implant that you
Compared to
wanted?
before,
I think he
Krystina's
just
breast
rushed
look
and
a
like
lot
decided to get what he
better
wanted to
bigger.
get.
Honey,
Fair
we do
to say
not want
she's
faster
much more
plastic
happy
surgery.
with how they're
Nuh-uh.
looking, and I'm certainly a lot more happy with them.
So are you guys ready? I'm ready. Woo! I've been ready for ages.
Krystina, you look beautiful.
Thank you,
What we
Andrew.
want to do first
Before my
is examine
surgery,
you.
my
Close
breasts
your
looked
eyes,
like
we'll
a
tell.
flying squirrel's nutsack. They hung
tight,
low,
don't let
they
me
were
open
saggy, and they went in different directions.
The good news is
But
that
now,
Crystal's
thanks
nerves
to
in her
Dr.
face are working
Dubrow,
fine. The
my
bad
back
news
is
is
back
that
and looking
Crystal's
better than
skin
ever.
is very tight, which limits my options on how to excise a skin graft. So a lot of it is skin mobility.
Okay, so
Your
I
skin is
still have
tight.
a little bit
So the
of
best
work to
option
do,
is
just a few finishing
removal
touches,
of
but I can't
that
wait for you to see
skin
it.
patch that you
Are you
have
ready?
there. That means we have
I'm
to
so
open up
ready.
a side, make a pocket over here along your cheek, put a tissue expander in.
I love
That means
it.
you'll be walking around for
It's
6 weeks or so,
fantastic.
maybe even
It's
8,
even
with
got my
mass
resting
in your
beach
face.
face going
The
on.
tissue expander is like a
Best
big
thing
balloon you
ever.
put underneath
That
the
can't
skin,
be.
and then
That
fill
looks
it with
even
fluid
better than I
every
think.
few weeks and get
And
it
then
bigger and
I
bigger
look
and
at my
bigger.
chest and I
That will
remind
give us
myself,
more elasticity
they're
of the skin,
perfect.
so when we take out
I
the
definitely
expander,
think this picture
you can cut
needs
out
to
the
now
skin
take
graft
place in
and
the
then move that
caricature.
extra tissue
Because the
into the
caricature
defect
was,
and
look at what
close
it could
it.
be.
So what do you think?
Now look at what I am.
Gone.
Yeah, definitely.
And thank you for sticking
wanna
by
what?
me,
wants
even
it
when
more.
I had
I want
squirrels,
it
not sacks.
It's worth it seeing the end
Smaller.
result.
No, she wants it